You do not need to live in pain, specifically pelvic pain. There is so much going on in here, and everything affects everything else. Everything is intimately intertwined. Let me show you. First, you have organs, lots of organs in the pelvis. So you've got your bladder, you've got your uterus, and you've got your rectum in the back here. Okay, so there can be something viscerally going on with the organs. There are also muscles, lots of muscles in the pelvic floor. There are muscles that are superficial, there are muscles that are deep. There are lots of blood vessels, there's lots of nerves in there, the little yellow guys in there. There are so many different systems that are intertwined, intimately intertwined, so they can all affect each other. So you can have a problem with one part of your pelvis and it affects another part of your pelvis. So the really hard part is, well, the first hard part is getting people to get checked out for what they have wrong, what they're feeling, for their symptoms. But the other part is trying to figure out where the pain is coming from. It could be your GI tract. It could be your genital urinary system. It could be your skin. It could be your muscles. It could be your nerves. It could be circulation. There's so many things that could go wrong, and it's really hard to diagnose. So the first step is just putting yourself first, advocating for your health, going to a specialist to try to figure out what's going on. You're probably going to get bounced around a bunch of doctors, and maybe they can't figure out what's wrong, so they're going to tell you it's all in your head. But it's probably one of these systems. There's so many that interact in the pelvis, so it's hard, again, to figure out what's going on. But keep trying. Keep going from doctor to doctor to specialist to specialist until you find someone who's really going to listen to you. This happened to me, and I had endometriosis, and I have a lot of GI issues, but I was passed off by many doctors and who just told me that it was all in my head because they couldn't figure it out. But just to show you again, there's just a lot going on in the pelvis, and don't give up if you can't find an answer. You do not need to live in pain. Pelvic floor physical therapists can help you sort these things out, and we can help you with your muscles and a lot of other things. So don't sit on your pain, literally, and go find a specialist who can help you live pain-free.